can have you hold your leg up there and meet my resistance. Does that give you any problem? Okay, let's just check the other side, see if it feels different to you. I can look at the length of the piriformis. Can she get her knee down to the table without rotating? Go ahead and push up there. Does that feel different? Similar. Okay, so our piriformis muscle test doesn't give us any good information. Piriformis length test, that looks pretty good. Let's do the other side. Put your back over. Bottom leg straight, top leg there. Maybe a little tired, but I'm already biased. I'm looking for it now. So, but nothing dramatic, but definitely different on the straight leg raise component. So let's just do a treatment. And a treatment I can do, piriformis is going to run from the trochanter all the way up to the edge of the sacrum. So I'm just going to do I'm going to put pressure on the muscle, and I'm going to stretch it while I add stretch to the muscle. So we're going to bring you to the edge of the table. We're going to visit our old friend Captain Morgan again. Okay, so I'm like this. I can even put your knee into my stomach to stabilize it and me. I'm going to put my fingers just proximal to the trochanter, right where the tendon of the piriformis would be coming in, which if this were a clock, piriformis is going to come in 12 o'clock, 6 o'clock, 9 o'clock, right about 10 o'clock, all right? So I'm going to a little bit of slack on the muscle, pin it. You're going to try and bring your foot toward the ground and follow me. Good, and adduct a bit. And we take pressure off a bit. I'm going to follow along the piriformis, pinning it and just stretching it. I'm going to jump over where the nerve is and pull. Now, pull toward me and stretch even more. We're going to do this 3 times and go back and recheck. Jump over where the nerve is. Stretch down. And you can actively kind of work with me, as long as you don't have any adduction pain. Okay? If you actively do it with me, you'll actually inhibit the muscle from contracting. So if you want the patient to actively work with you, if you can, because this muscle wants to externally rotate and adduct. So she internally rotates and adducts. I'm sorry, muscle wants to internally rotate and AB, and if she externally rotates and adducts, she'll stretch it. So I'm just kind of jumping back and forth. Let's go back and test it. Get on your back. And we'll see if it improved or not. Hopefully it did. If it didn't, then we could try it again with a little more intensity. Is that good?
Yeah.
How's that now? Still there? How about this way? Okay. But I'm rotating it further, but she's still sensitive to it. So that might be a situation where she's always going to have it, but if she manages it by keeping the piriformis mobile, how's your leg and foot feel right now? Okay, lay you on your back. And I'm going to show you another technique to glide the nerve out. So bring your leg up. We're going to floss it. How's it right now? Is it still tingly?
No.
So floss is I'm pulling the nerve tight here, giving it slack here, I'm pulling it tight at her foot, tight at the knee, less tension here, and less tension there. So I'm varying the tension along the nerve by when I add tension somewhere, I take tension off somewhere else. Does that make sense? We're sliding her leg along the nerve. Her straight leg raise is all the way up here. I can also just rock her hip back and forth without the nerve being under tension at all. That'll also clear the nerve with the piriformis. How's that feel? Foot feels good now?
Yeah.
Okay, good. All right, so at home, what do I have her do? I would have her take a lacrosse ball, use the lacrosse ball on her piriformis while she would be stretching her piriformis. Just keep it mobile. And then also, I'd have her glide the nerve. So her nerve glide would be grab a hold, pull up, straighten out your knee to feel a little bit of tension, not too much, and plantar flex your foot. And I would take a little bit of hip motion out and dorsiflex your foot. Pull in and plantar flex, but pull as far as you can this way. Plantar flex, good. Take a little tension out and dorsiflex. Good. So you're causing a little bit of nerve tension, but sliding plantar flex. And take a little tension out and dorsiflex. Back and forth. Does it feel kind of good? Okay. We're going to try one more time and see how sensitive the nerve is. We're going to go end range. I'm going to stop. Get tight. Carefully. Not as bad? Alright. So we're trying to calm down the nerve irritation. Alright. So what we're going to do now, we're going to go back to the notes. I'm going to let, during lab, you guys can try this, but let's do some other things.